CEN Exam Prep Institute. Question 1. A patient presents to the emergency department reporting slurred speech and an unsteady gait for about 6 hours with complete resolution of the symptoms. Which of the following statements by the patient would be a priority to follow up? Option A. I haven't been able to refill my blood pressure medication for a few weeks. Option B. I use cannabidiol, CBD, edibles to help me sleep. Option C. I was diagnosed with Guillain-Barré syndrome as a child. Option D. My grandmother had rheumatic heart disease. The correct answer is option A. I haven't been able to refill my blood pressure medication for a few weeks. This patient's symptoms describe a transient ischemic attack, TIA. Uncontrolled hypertension is a major risk factor for future stroke and requires immediate intervention. While CBD use, B, may be important, it is not as critical as uncontrolled hypertension for TIA management. Guillain-Barré, C, can cause similar symptoms but is not the priority. Family history of rheumatic heart disease, D, is less relevant. Question 2. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution. Question 3. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient in atrial fibrillation with rapid ventricular response has a heart rate of 152 bpm and is hypotensive. Which intervention should the nurse anticipate? Option A, administration of 4-diltiazem. Option B, administration of 4-amiodarone. Option C, synchronized cardioversion. Option D, administration of 4-digoxin. The correct answer is option C, synchronized cardioversion. In unstable atrial fibrillation with rapid ventricular response causing hypotension, synchronized cardioversion is the immediate treatment of choice. Hemodynamic instability indicates the patient cannot tolerate the rapid rate and requires immediate electrical conversion. Chemical rate control with diltiazem, A, amiodarone, B, or digoxin, D, is appropriate for stable patients but is too slow for unstable patients. Question 5. Which of the following ECG findings is most consistent with pericarditis? Option A, ST- segment elevation in all leads with reciprocal depression. Option B, diffuse ST- segment elevation with PR- segment depression. Option C, ST- segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST- segment elevation with PR- segment depression. Acute pericarditis classically presents with diffuse, global, ST- segment elevation across most leads along with PR- segment depression. The ST- segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 6. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 7. The possibility of an ectopic pregnancy increases when a patient has a history of Option A, breast cancer. Option B, endometriosis. Option C, teenage pregnancy. Option D, pelvic inflammatory disease. The correct answer is option D, pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 8. A patient is scheduled for an abdominal CT with oral contrast. Which finding in the patient's history may require special preparation or alternative imaging? Option A, diabetes mellitus. Option B, hypertension. Option C, allergy to shellfish or iodine contrast. Option D, asthma. The correct answer is option C, allergy to shellfish or iodine contrast. Allergy to shellfish or iodine contrast is a concern due to cross-reactivity with 4 contrast agents. Pre-medication with steroids and antihistamines may be needed. Diabetes, A, and hypertension, B, are less significant. Asthma, D, is relevant but less directly impactful. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 10. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D, assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra-minus abdominal bleeding. Assessment of vital signs and signs of shock are the priority. 4 fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 11. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A, apply fresh water to the area. Option B, apply vinegar to inactivate nematocysts. Option C, apply heat to the area. Option D, rinse with seawater and apply ice. The correct answer is option B, apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 12. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A, naloxone. Option B, flumazenol. Option C, naltrexone. Option D, methadone. The correct answer is option A, naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenol, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 13. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A, explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B, tell the patient they must undergo the exam to report the assault. Option C, perform the exam yourself to minimize the number of people involved. Option D, delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice. Question 14. A patient is bitten by a venomous snake. What is the priority nursing action? Option A, apply a tourniquet above the bite. Option B, immobilize the affected limb. Option C, administer antivenom immediately. Option D, incise and suction the wound. The correct answer is option B, immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 15. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A, inability to abduct the fingers. Option B, inability to oppose the thumb. Option C, inability to adduct the thumb. Option D, decreased sensation in the small finger. The correct answer is option B, inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 16. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 17. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, acute coronary syndrome. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 18. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and nuchal rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, nuchal rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with an acute shoulder dislocation. The nurse notes the arm is held in abduction and external rotation. What is the most likely type of dislocation? Option A, anterior dislocation. Option B, posterior dislocation. Option C, inferior dislocation. Option D, superior dislocation. The correct answer is option A, anterior dislocation. Anterior shoulder dislocation is the most common type and typically presents with the arm held in slight abduction and external rotation. Posterior dislocations, B, are less common and present with the arm held in adduction and internal rotation. Inferior, C, and superior, D, dislocations are rare. Question 20. A patient presents with agitation, confusion, and is hyperthermic after ingesting a street drug. The patient's pupils are dilated, skin is dry, and the patient is tachycardic. What is the most likely drug involved? Option A, cocaine. Option B, methamphetamine. Option C, anticholinergic drug, example PCP. Option D, ecstasy. The correct answer is option C, anticholinergic drug, example PCP. The anticholinergic toxidrome is characterized by red as a beet, dry as a bone, hot as a hair, blind as a bat, mad as a hatter, flushed skin, dry skin, hyperthermia, mydriasis, dilated pupils, and delirium. Cocaine, A, and methamphetamine, B, cause tachycardia but also diaphoresis and constricted or dilated pupils depending on the stage. Ecstasy, D, can cause similar symptoms but typically also includes diaphoresis. Question 21. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 22. A patient with acute pancreatitis has the following labs. Which finding is most concerning? Option A, elevated serum amylase. Option B, elevated serum lipase. Option C, elevated blood glucose. Option D, decreased serum calcium. The correct answer is option D, decreased serum calcium. Hypocalcemia in acute pancreatitis is a poor prognostic sign. It occurs due to saponification of calcium with fatty acids in necrotic fat tissue. Hypocalcemia can also indicate severe pancreatitis with significant necrosis. While elevated amylase, A, and lipase, B, are diagnostic, they do not indicate severity. Elevated glucose, C, is common but less concerning than hypocalcemia. Question 23. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, Assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 24. Which of the following is a priority intervention for a patient with priapism? Option A, administer pain medication. Option B, apply ice to the genital area. Option C, prepare for surgical intervention. Option D, administer oxygen. The correct answer is option C, prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Question 25. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A, assess fetal heart rate. Option B, obtain maternal vital signs. Option C, prepare for emergency delivery. Option D, perform a pelvic examination. The correct answer is option B, obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the 3rd trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out.